The second part of the interior of the base of the skull is the middle cranial fossa. So it is the middle part, anterior cranial fossa, posterior part, posterior cranial fossa. So in between these two fossa is the middle cranial fossa. Then what are the bones and boundary of the middle cranial fossa? Centrally here is by the superior surface of the body of the sphenoid bone. This is greater ring of sphenoid, and then the squamous part of the temporal bone. This is the squamous part of temporal bone. Here, this is temporal bone, and this is squamous part. So we can see the squamous part of temporal bone is this one. So from inside we can see this is the squamous part of the temporal bone, and this is the anterior surface of the petrous part of temporal bone. Then what are the boundary of this fossa? Laterally by the squamous part of temporal bone, this one, and posteriorly by the superior border of petrous part of temporal bone, and anteriorly the posterior border of the lesser ring of sphenoid. So here in this lateral part of this middle cranial fossa, there are so many fissures and foramen. And in the central part, on the superior surface of the body of the sphenoid, there are some important anatomical features. Let us discuss the central part, then followed by the lateral parts. In the central part, I already told you during discussion on the anterior cranial fossa, this is jugum sphenoidale. So this is the posterior border of jugum sphenoidale, this one. From there, it starts, that is the middle cranial fossa starts. Here we can see this is one sulcus here. This is called sulcus chiasmaticus, and this sulcus chiasmaticus extends through the optic canal into the orbit. That means here the optic nerve crosses with each other forming a optic chiasma. But it is not the true fact. The true fact is that the optic chiasma, it is above and just behind the level of the sulcus chiasmaticus. And posterior to this sulcus chiasmaticus, here this ridge is called the tuberculum celli. This one. This tuberculum celli is a bony ridge, and behind the tuberculum celli is a depression called hypophyseal fossa or pituitary fossa, where there is a lodgement of pituitary gland, and deep to this gland is the sphenoidal layer sinus within the body of this sphenoid. Here is the cavity inside the body, that is the position of sphenoidal layer sinus. Then what is the importance of this position of the sphenoidal layer sinus? As because this sinus is located deep to the sella turcica, the most direct surgical route to the pituitary fossa is the transsphenoidal approach. And I mentioned one term called sella turcica. What is that? The sella turcica, the name is due to the fact that it resembles the shape of a Turkish saddle, and it is formed by three structures: anteriorly tuberculum celli, then pituitary fossa, and posteriorly dorsum celli. This one. So these three together called the sella turcica. And on each side here there is a depression or sulcus called carotid sulcus, which lodges the internal carotid artery here, and also cavernous sinus. And here you will get one process, small process. Can you see this small process on the lateral side? This is called the middle clinoid process, which arises from the body of the sphenoid at the anterolateral margin of this sella turcica, this one. This middle clinoid process and anteroclinoid process, they are connected by a ligament called carotidoclinoid ligament. Sometimes the ligament ossified to form a bone. Posterior to the pituitary fossa, this one, this flat surface, this plate of bone is called the dorsum celli. So dorsum celli is a square-shaped plate of bone which projects upwards and laterally as the posterior clinoid process. This posterior clinoid process, it is connecting with the anterior clinoid process by interclinoid ligament. And here is the attachment of the attached margin of tentorium cerebelli. The upper margin of the dorsum celli provides posterior attachment of the diaphragma celli. Below the posterior clinoid process, on the lateral side, there is a small process, this one. This is called petrosal process. This process, it is connected with the apex of the petrous part of temporal bone by a ligament called petrosphenoid ligament here. So forming a gap deep to this petrosphenoid ligament through which passes the abduction nerve. It is clinically important. Sometimes this ligament presses on the abduction nerve. So abduction nerve may be trapped in between this bone and the petrosphenoid ligament. If you are asked what is another name for the petrosphenoid ligament, this ligament is also called the petrosphenoidal ligament of Gruber, and the canal deep to this ligament between the bone and this ligament is called, this canal is called Dorelow's canal. Through this canal, the structures passing, I told you already, one is abduction nerve and another one is inferior petrosal sinus. Come to the lateral side. That is the structures on this greater ring of the sphenoid and also on the anterior surface of the petrous part of temporal bone. If you see separately the greater ring of sphenoid here, this is the sphenoid bone. Between the greater ring of sphenoid and lesser ring of sphenoid, there is a fissure, this one, retort-shaped fissure called superior orbital fissure. And this fissure, it is divided by a annulus tendinous into three parts: medial, intermediate and lateral. It is a very common important short note, superior orbital fissures, or may be asked during viva voce examination what are the structures passes through the superior orbital fissure. The structures passing through the lateral compartment of superior orbital fissure, the three important nerves, that is frontal and lacrimal branch of ophthalmic division of trigeminal nerve and trochlear nerve. So the frontal, lacrimal and trochlear, you can remember in this way, LFT. L means lacrimal, F means frontal and T means trochlear. And the arteries are lacrimal branch of middle meningeal artery and recurrent meningeal branch of ophthalmic artery, and one vein, that is superior ophthalmic vein. Come to the middle part or intermediate part, that means within the common tendinous ring. Here you will get again three important nerves, that is the oculomotor nerve, nasociliary nerve and abduction nerve. Both the divisions of oculomotor nerve will be there. Then nasociliary, which is the branch of the ophthalmic division of trigeminal nerve, and one vein is there, that is superior ophthalmic vein. If you are asked what are the branches from the ophthalmic division of trigeminal nerve, the branches are three: frontal, lacrimal and nasociliary. Frontal and lacrimal, these two branches passing through the lateral compartment, and nasociliary nerve, it is passing through the middle compartment. Then come to the medialmost part, through which passes the inferior ophthalmic vein. So all these are the structures passing through the superior orbital fissure, which connects the middle cranial fossa with the orbit. Then come to the other foramens in the greater ring of sphenoid. Behind this superior orbital fissure, another foramen is there. If we see in the middle cranial fossa, in this base of the skull, here you can see there is one foramen here. There is just behind this. This foramen, it is round shaped, so it is called foramen rotundum, through which the important nerve passing is the maxillary division of the trigeminal nerve or maxillary nerve. about 1.25 centimeter behind the foramen rotundum, another foramen which is rather larger than the foramen rotundum and oval shaped. It is called foramen ovale. The structures passing through the foramen ovale are sensory part of the mandibular nerve, motor part of the trigeminal nerve. That means this motor part also the part of the mandibular nerve. So mandibular nerve having two components, sensory and motor, both are passing through the foramen ovale. Then another important nerve is the lesser superficial petrosal nerve and one artery, that is accessory meningeal artery, and two veins. One is anterior trunk of middle meningeal sinus and emissary veins. And behind the foramen ovale, another foramen is there close to the spine of the sphenoid. If I see in this separately in the sphenoid bone, behind the foramen ovale, this foramen, small foramen, close to the spine of sphenoid is called foramen spinosum. And through this foramen spinosum, the structures passing is the posterior trunk of middle meningeal sinus. That means the middle meningeal sinus having two trunks, anterior trunk passing through the foramen present anteriorly, that is foramen ovale, and posterior trunk of middle meningeal sinus passing through the foramen spinosum, which is the foramen behind the foramen ovale. So anteriorly anterior trunk, posteriorly posterior trunk. So besides this and posterior trunk of middle meningeal sinus, the structures passing through foramen spinosum are the middle meningeal artery and nerva spinosus, or it is a meningeal branch from the trunk of the mandibular nerve. So three structures passing through this foramen spinosum. One nerve, that is nerva spinosus, branch of the trunk of the mandibular, one artery, that is middle meningeal artery, and one vein or venous sinus, that is posterior trunk of middle meningeal sinus. And sometimes one foramen you can see here in between this foramen rotundum and foramen ovale. Here in this bone you can see the foramen here, this foramen. What is this foramen? This foramen sometimes present but not always present, and if it is present, which structure passes through this foramen? And this foramen between this ovale and rotundum is called emissary sphenoidal foramen or foramen vacilli. So the foramen vacilli, if present, it gives passage to the emissary vein which connects the cavernous sinus, which is present here, with the pterygoid penis plexus, which is present below. And sometimes another foramen may be there behind the foramen ovale. This is in front of foramen ovale. And another foramen occasionally present between the foramen ovale and foramen spinosum, in between these two. Here we cannot see the foramen. If present here, this foramen ovale and spinosum in the bony bar is there in between these two. If it is present, it is called canaliculus innominatus. If it is present, it transmits the lesser petrosal nerve, which usually passes through the foramen ovale here. If it does not pass through the foramen ovale, in that case, canaliculus innominatus transmits the lesser petrosal nerve. This supraorbital fissure, it is connected with the orbit. If I see here, supraorbital fissure is here, it is connected with the orbit anteriorly. Foramen rotundum or round foramen, it communicates with the pterygopalatine fossa, and the foramen ovale and foramen spinosum, they are connected with this fossa, is called infratemporal fossa. So infratemporal fossa by these two foramen and pterygopalatine fossa by the foramen rotundum and orbit to the superior orbital fissure. And another important foramen is found here, this one. This is called foramen lacerum on both sides. Why it is called foramen lacerum? Because the margin of this foramen is lacerated or irregular. So the name is foramen lacerum. If you are asked, is it actually a foramen? The answer is no. Why? Because this foramen is not present in any of the bone. It is a gap found between the three bones, that is petrous part of temporal bone, greater ring of sphenoid bone, and here is the occipital bone. So occipital, then temporal and sphenoid. These three bones, when articulated, they form a foramen called foramen lacerum. And this foramen, it is covered by, in the lower part, by fibrocartilage. And the structures passing over the foramen is the internal carotid artery. If I pass the internal carotid artery in this way through the foramen lacerum, petrous part of temporal bone, this way, coming through the apex of the petrous part of temporal bone, and here if I see in the cranial fossa, this is the apex of temporal bone, then passing on each side on the carotid sulcus, then running upwards through the cavernous sinus. But the structures passing through the foramen is the nerve of pterygoid canal, which is formed by the deep petrosal nerve and greater petrosal nerve, and the vessels, that is pterygoid vessels, and some terminal branches of the ascending cranial artery. So all these are the structures on the foramen lacerum and the passing through the foramen lacerum. So internal carotid artery, it is not passing through the foramen lacerum, it is rather passing over the foramen lacerum. And passing through the foramen is the nerve of pterygoid canal and vessels, and terminal branches of ascending pharyngeal artery. Last but not the least, the depressions and some grooves on this surface. The depression due to the sulci and gyri on the inferior surface of the temporal lobe of the cerebral hemisphere, and the grooves for the different arteries and veins. Particularly, these veins form the groove or marking on the interior of the squamous part of the temporal bone, and also the greater ring of sphenoid bone. So all their grooves due to this impression of the vessels, and the depressions for the gyri of the undersurface of the temporal lobe of cerebral hemispheres. So all these are about the middle cranial fossa.